This House has considered impact of alcohol duty on the UK wine sector. Dr Scott Arthur.
Thank you, Mr Turner. What a pleasure it is to serve under you this evening. And I do want to thank the member for Farnham and Bordon for introducing this debate so ably, actually, and there's much I agree with what he said. He did present a number of questions for the Minister around the operation of alcohol duty. And I think one of the questions that was perhaps missing was around the health impacts of having the wrong level of alcohol duty in the UK. And that's part of what I want to touch on my speech. So in my life, the English wine has moved from a feature of jokes on sitcoms to a premium product, both in terms of price sometimes, but also its quality, more importantly. And I'm pleased to see that Scotland's wine industry is also growing. In 2025 so far, 5 new vineyards have registered with the Food Standards Scotland, and I hope this industry will continue to flourish and grow. I also have to say I'm proud to have the North British Distillery, one of Scotland's oldest and largest Scotch grain whisky producers, in my constituency. I'd be in trouble if I didn't mention them. And I do hope that any consideration to changes in alcohol duty consider the whole of the industry in the UK rather than just one part of it. So as much as I want to see these industries thrive, and I absolutely do, we have to do that whilst being conscious of the public health implications that alcohol can have. It's our responsibility to find the right balance with an alcohol duty that works for businesses, as we've heard, but also supports public health. We need an alcohol duty system that works for our wine industry and also supports the hospitality sector and improves public health. So I want to talk about informed moderation when it comes to drinking. I'm not here to lecture anyone. I enjoy a drink like everybody else, but I'm a real advocate of people being aware of some of the implications of consuming alcohol. So I'm concerned about 4 things, really. I think that drinks are getting stronger, and that's certainly been the case in my lifetime. And I think sometimes that's to the detriment of the taste of some wines. We are drinking more at home post-COVID, and that has real health implications. And I have to also say, Chair, I'm eating more crisps at home as well post-COVID. It's a serious point, actually. Our hospitality industry is under huge pressure, and this impacts on the vibrancy of our high streets. And we have a duty to ensure public are aware of the risks of drinking. So I recently met with the Scottish Health Action on Alcohol Problems. They told me that in Scotland in 2024, there were a total of 1,185 alcohol-specific deaths registered. This was the lowest number registered since 2019, something we should celebrate. And it's perhaps, at least in part, due to minimum unit pricing of alcohol in Scotland. But it still shows the damage that excessive alcohol consumption can do, and that it remains too high in Scotland and elsewhere. So by choosing to consume lower strength alcohol, we can continue to enjoy drinking and the benefits it does bring to us in social occasions, whilst also addressing the harms that are caused by alcohol. And I do welcome the fact that the government is looking quite seriously to meet its commitment to label alcohol, just like we did with cigarettes in the past as a country, to make people more aware of some of the risks that come with drinking. For example, the World Cancer Research Fund told me that alcohol-related breast cancer can be caused even by low levels of consumption of high-strength alcoholic drinks. Reducing the strength of alcoholic drinks can reduce the likelihood of this type of cancer. I have to say, Mr Turner, they told me about this at the Labour Party conference in Liverpool. Not the best place to give people advice on drinking a little bit less. So this is why I feel a well-designed minimum unit pricing system across the UK is worth considering alongside a meaningful and well-structured alcohol duty regime. But I understand some of the concerns people have about minimum unit pricing of alcohol. And many people, activists in the sector, look back to when Alistair Darling was Chancellor in the UK and the changes he made to the alcohol duty regime and how it directly related to improved health outcomes for people. And I think that is something we can learn from. I'm always proud to say I followed him, although there was somebody between us as MP for Edinburgh South West. Alongside an effective duty system, it is also right that we encourage drinking in as safe an environment as possible while supporting our hospitality industry. So during a meeting with the Institute of Alcohol Studies last month, they told me that freezes on alcohol duty disproportionately benefit the sales of alcohol in shops, allowing supermarkets to maintain lower prices in comparison with hospitality venues. And this is what is at the heart of so many pubs feeling distressed, because it's just so much cheaper for people to drink at home than it is compared to pubs and other venues. And hospitality is a massive employer in the UK, which is under huge stress just now. And I do think we have to look at how we look at taxation of alcohol right across the board to make sure we're benefiting that sector whilst also reducing harmful drinking at home. An effective alcohol duty can support many of these jobs by closing the gap between the prices in pubs and supermarkets. This in turn encourages people to drink, hopefully British-produced alcohol publicly, which is far safer than consumption in private. So in conclusion, Mr Turner, it is right that we take time to thoroughly consider alcohol duty system and make sure it works for our wine industry and also people like the North British Distillery in my constituency. But we also have to see this debate as an opportunity to support the hospitality sector and improve public health. These are three really important things, and I don't envy the Ministry's job in trying to reach a balance between them. Thank you.